A study commissioned last year showed potentially big savings if the state sets up its own insurance plan for its employees. But the co-chair of the state's budget committee isn't convinced that's right for Wisconsin. It was just one sentence with no details.
One area to consider for real reform is the way we administer health insurance for state employees, which some experts believe could save tens of millions of dollars.
But it was followed up with a big promise.
Tonight, I commit to investing every penny of savings to the general fund from these specific reforms to support public education.
That specific reform mentioned in the State of the State address is self-insurance.
The state itself would kind of become its own insurance company.
Right.
And by doing so, it then takes all the kind of liability and litigation costs that come with insurance.
Right now, state employees pick from a variety of health plans offered by different insurance companies. It's a system the Senate's budget leader believes in.
We have to look at the impact of self-insurance on the free enterprise system and our healthcare system to date, because our healthcare system is one of the best in the country.
Senator Alberta Darling isn't sure the change is the right move.
And we have to make sure we're not going to impact the competition, the free enterprise market in healthcare, just like Obamacare has not proved to be cost savings, or if you have your doctor, you can keep your doctor. So I think people are very much concerned about change right now.
It's definitely a long-term marathon type policy. I mean, that's the problem, is that we're trying to explain this as saying, well, we do this now, it costs this, but 10 years down the road versus what's now in place, it would be immense savings.
Now, to start a self-insurance plan, the state would have to triple its cash reserves, which likely means it can't happen over the next 18 months because of the new projections, which show Wisconsin's budget surplus is about $100 million lower than originally thought.